This evening's webinar is about guiding patients to yes. You can actually help patients come to the conclusion that they want to take care of themselves, and you can help them make up their own mind. And what I like is that we've got this tool called the Smile Wizard that helps you collect all the data that you need during the examination, and it allows you to put it in one compact place. And then, the original design was to be able to help you, keep all your records in one place, and then, come up with a treatment plan, and, because everything was all together and everything you needed was in one place. But as a practice management consultant, I get to play doctor tonight, but I'm not a dentist. But you'll let me know how well I do here. But as a management consultant, I'm like, wait a minute, you can use this to help you with your treatment planning, but we're forgetting we can use this for treatment presentations because the information's all there, and you don't have to take it out, and you don't have to do other things with it. I mean, you could if you want to. If you didn't have the Smile Wizard, you've got the pictures. I'm sure you take them during your examination, and you could use a program like PowerPoint to draw lines on it and measure it, and show smile lines and things like that. But here it's already done. So that's what I like about it. And so I just want to show you how to use this tool. If you want to learn more about the Smile Wizard, you can certainly give Travis a call, and I'm sure he'd help you walk through the whole thing. But what I want to show you is how using these pictures, the pictures that you take during your examination, can be a great assistance to you when you are presenting treatment to a patient. And I want you to feel good about it. Because patients like it when you collaborate with them about their treatment. I'll probably say it once, I'll say it a million times. Patients don't like it when other people make decisions without their input. And so a part of your examination, it should be a collaborative process, So let me just walk you through this. I know some of you have heard me talk before. And so you kind of know some of my theories of things. There's some things that have to be in place before we ever get to a presentation. And I want to spend just a couple of minutes talking about that. And so definitely, I want to give you a formula that you can follow. And this formula is what helps patients. This is what helps patients come to the conclusion in their own mind that, you know what, I need to take care of myself. I need to do this. It helps them with that collaboration that they're looking for. And the way this formula works is we got to know the patient's why. And then we have to know the conditions that are present, because people do things for their own reasons. They don't do them for our reasons, and so we've got to know why they're seeking care, and we need to find out what's important to them. People do things for their reasons, not ours. Not just because we told them. It doesn't work that way anyway today, because most people think they know more than you do. So we have to understand why. We've got to recognize the conditions that are present. Let's say, for instance, if you have a patient who says, I want to be able to keep my teeth for the rest of my life. Well, then we have to have the ability as dentists, as clinicians, to recognize what conditions are present in the patient's mouth that will keep them from keeping their teeth for the rest of their life. And so patients have to understand the problem, because they'll risk making no decision over a bad one. And I think we've all experienced that. And that's usually a sign of confusion when a patient just doesn't know how to take care of themselves. And so we've got to understand the conditions. And then, of course, we have to know the implications of not treating themselves. So the conditions work together with the implications. I brought this up because conditions like this cracked tooth, leads to people losing their teeth. because if the tooth split right down the middle, then there's a good chance that we won't be able to restore it, and you'll lose it altogether. And I just don't know what it would be like if you lost that tooth. So we have to understand what's important to them. We have to understand the conditions that interfere with what's important to them. And we also have to have a keen understanding of the implications. What happens if the patient doesn't move forward with treatment? And the reason why I bring this up is because a lot of our patients think that dentistry is static. Like if you have a crack in your tooth, it'll just stay cracked like that and it won't get any worse. When we all know that dentistry is progressive, it's a progressive disease, it's going to get worse over time, but patients aren't thinking that. And the number one thing that tells me that patients aren't thinking that way is how many times are you talking to a patient and they say, well, I know that it's cracked, but it doesn't hurt. And you think, oh gosh, and a little piece of you just dies because it's like, now how do you get around that? And so we've got to be good at talking about the implications, because when the patient recognizes, oh, I had no idea a crack like that could turn into something like this, like me maybe losing my teeth. Oh my gosh, I don't like that at all. I think we need to move forward with something. We need to talk about it. So those implications are really, really important. And so what I like about using the Smile Wizard is that when you're talking to patient, you can combine words with visuals so that patients begin to see and hear the path of decline or destruction of whatever's going on in their mouth. And so we can explain things like, once teeth begin to wear, they're going to continue to melt away until there's nothing left. And so that's the problem for people who have the kind of problem that you have. And so that's why we have to understand those implications. And I like pictures, and I like the way that you can store them in the Smile Wizard, because you can show people the progression of let's say tooth wear, like I'm showing in these pictures. And I like pictures of people in different stages in their lives, like wear on a 30-year-old, wear on a 40-year-old, wear on a 60 or 70-year-old. A lot of times we show patients a 30-year-old, we show them pictures of wear of a patient who's 80, and we say, look at this old guy. You know what I mean? Look what happened to his teeth. I just wouldn't want that to happen to you. But you guys know as well as I do, for a 30-year-old, they're thinking, well, I got 50 years to worry about this. And so that's why I like wear pictures or broken tooth pictures or whatever it is, all within the same age, so that you can show them that, you're right here, but look at this guy right next to you. He's just a few years older than you are. And what I see happening already to you is the same thing that happened to him. It's just that he didn't get to it soon enough. And I just don't know what it would be like if your teeth, got to that point. So we've got to understand and have those pictures, but know those implications so we can relate it back to the patient. And then, I like a simple test buy-in. Most dentists I've ever met, they always worry about moving forward. I don't know. I know it would be best for the patient, but I don't know what they think about it. And I don't want you to worry about things like that, because when you show them something, you can always do what I call it, just a test buy-in. Say, Mr. Jones, what do you think about what's happening to you? Has anyone ever talked to you about this before? What's going through your head? And what you're doing is you're just giving a little test buy-in to find out how important is this to a patient. So you show them something and you say, tell me your thoughts about what's happening to you. Most logical people are going to say, well, gosh, I don't like this, doctor. What do you think I can do about it? And then it's like, the clouds part, the sun comes shining through, and it's just like, well, maybe this is a good time for us to talk about it. So you can ask them questions like, tell me how you feel about what's happening to you, or tell me how concerned you are with what we discovered today, because the patient will always guide you to what's most important to them. And when you know what's most important to them, then you know the treatment plan to write, because the treatment plan that you write is going to match up with what that patient is looking for. And it makes sense for them to want to come up with a way to fix this. And so that's where you get commitment from the patient. So you're learning from them, and I'll show you how Dr. Dawson did this, but you're showing them how to move forward with their treatment. But you don't have to worry, am I writing a treatment plan that they'll never agree to? You don't have to do that at all. So the communication that leads to commitment, it sort of sounds like this. Earlier you shared how important it was for you not to lose your teeth. And I'm mentioning this because I'm concerned about these things, these broken teeth, these cracked teeth, that you've got in your mouth. And why I'm worried is because this leads to people who lose their teeth, and you might not have known about this because your body usually doesn't tell you about it until it hurts or it's too late. So I'm wondering if this is a good time for us to talk about keeping this from happening to you. Does it make sense for us to devise a way to solve this? I'm doing that little test buy-in to find out where they are with the situation. So I asked them, tell me, how concerned are you with, like what we discovered today? They'll give you the answer. And then you can inquire, would it make sense for us to come up with a way to fix this? Matter of fact, this formula can be used with your hygienist, with your dental assistants, even the front desk. Because when the patients go to them and say, I'm concerned about what the doctor had to say about my teeth, your team should understand, what do those conditions lead to? And say, well, he only brought that up because he was worried it would cause you to lose your teeth. I'm wondering if it would make sense for you and I to sit down and just talk about the treatment recommendations that he made, and that way you can let me know what you think about it. Maybe there's something that we can do, And so in the handoff, say from the hygienist to the business office, or anybody to the front desk, it would be, Ms. Jones wants to take care of the concerns that we uncovered today. And so that's how you can move forward with all of this. So it doesn't have to be really complicated, but if you're taking any notes, I would like you to write down why plus conditions plus implications along with a test buy-in equals commitment, because that's where you'll learn where that patient wants to go. And when they realize they don't like the direction that their teeth are moving in, that's when they ask that magic question, Doc, what do you think about this? Or Doc, what do you think I should do? When you get them to that point, then they're going to be moving forward with something. So you got to be prepared. That's why we do an exam. And so I appreciate this opportunity to play doctor with all of you this evening. And in the interest of full disclosure here, I'll let you know I'm excited about the Smile Wizard. I like it as a really good tool, but I don't have any financial interest in the Wizard at all. And so the only interest I have is how it can be used to help dentists diagnose complete dentistry and present it to their patients. So it's a really good tool, and I feel like it's easy to use, and you already have the information. Why recreate it for a presentation for the patient? Many of you are going to collect data over time. You're doing this already, and so you're going to have the information. So you want to be prepared. I like when you do a good examination, because when you do that, you've got most of the information that you're looking for is in front of you. And so you can start to have an end result in mind. You start envisioning it yourself, what this patient could look like, how much comfort they could have, how much more function they're going to have, how much better it's going to look, how they'll be able to keep it clean. So I do want you to write down all of these steps and create a checklist for yourself, so that way you'll have a format to discuss treatment with a patient. I'm not going to be discussing anything that you haven't heard us talk about at Dawson. And I'm certainly not going to be talking about anything that Dr. Dawson has never mentioned before. There's not a way to recreate, there's not a reason to have to recreate the wheel. But you start everything by being prepared and knowing where you want to go. And part of that preparation should be to review the notes from the initial phone call, from the preclinical interview, your study models, x-rays, pictures, scans, anything like that. You always want to be prepared for a presentation. I never recommend that anybody goes into it cold. Even if you're doing a review of findings, or if you are going to present treatment to a patient on the same day that they've had an exam, I think it's okay to have them go with the treatment coordinator into a private area, and you just explain to them, let me sit down and get my thoughts together if you feel like you need it. Nobody has a problem with that. What I wouldn't recommend that you do is that you just leave the patient by themselves in silence. Make sure that they're always with either a dental assistant or they're with your treatment coordinator. And then you can move forward from there. So you're prepared because you've got all the information that you gathered during your presentation. During your examination, and you've got it all in front of you. So I think preparation, or the best preparation, is knowing exactly what type of problem the patient is suffering with. So the Smile Wizard will make sure that you have all the right information, and it won't allow you to skip anything. So you're not going to be cutting corners or anything like that, because a thorough examination gives you the competence to be confident speaking to a patient, because you not only understand their problem, but you can begin to work through the steps to know how to solve it and help the patient understand the implications of living with the type of problem that they have. You see, while gathering data, you can review conditions present in the patient's mouth, as well as get feedback on how they feel about what's happening to them. Dr. Dawson talks about this all the time. Whoops, I just pushed a button that sent me way ahead of things. Let me go back. Okay, there I am. Dr. Dawson talked about this a lot while he was teaching, and he would explain to people that we don't want to make patients do something that they don't want to do, So he instructed to us over and over that as we examine the patient, we should be explaining what we are doing and why we're doing it, and then inquiring what the patient thinks or feels about it. So I can't emphasize enough how important this is, because patients today just will not allow you to make decisions without their input. People today think they know more than you do because they have so much information that's available to them. I want you to think of the exam being more than just gathering data. It's an exchange between you and the patient, and another way that you can connect with them. But what patients are looking for today is collaboration. That's what they're looking for. And so they want to know that you're taking their feelings into consideration. So Dr. Dawson always told us that while we're gathering data, we're always thinking in terms of optimum oral health. That means that you should always explain to the patient how you would like to talk about what would provide optimum oral health to the patient. And so you let them know, I just want to look at what would be best for you. And you can let me know what you think about that. Because our definition of optimum oral health is health that can be maintained. It's health that can be maintained. And it's, I got tongue tied there. It's like our definition of optimal health is oral health that could be maintained, that it's comfortable, that it lasts a long time, and it looks good. It kind of meets that criteria, and that you've only considered treatment that meets this criteria. And if having this kind of dentistry is going to create a problem for you, then can we talk about it? That's all you would like to do. And so this is why you've asked the patient to sit down and review findings together. so that you could take a look at things and get their input about what's happening to them and what is going on and what we could do about it. So in the case of this patient, I would go on to explain that if you only considered treatment, if you look at the conditions of this patient, what I would say to them that I've only considered treatment that would stop headaches, prevent wear, be comfortable by keeping the jaw from popping and clicking, and what would look good. So we'll get your smile back and to the way that it looked for a person your age, because your teeth are definitely aging faster than you are. And so after explaining optimum oral health, then you can review what you saw during the exam itself. So you would go over the problems. And you'd want to do this because you want to get agreement from the patient that there is a problem. There's no sense in moving forward because if the patient doesn't understand the problem, they cannot understand the implication of letting their problem go untreated. So it all starts with them recognizing those conditions and agreeing that having a cracked tooth is probably not a good idea, or a chipped tooth, or worn teeth, or anything like that. So you want to go over the problems that you saw, and you want to get commitment from the patient what's happening there. So as I said, until the patient understands the problem, they can't understand the implications. And if they can't understand the implications, it's not likely that they're going to move forward. So what I like about the Smile Wizard is I'm able just to put in my notes what was going on with the patient when they first came in. And in the case of this patient had commented that my front teeth are wearing away. I'm not happy with my smile. I'd like to have treatment done as quickly as possible. I want to be able to keep my teeth for the rest of my life. And I don't want to have the problems that I see my parents are having. And so I like that I can just have these really quick notes available to me. The patient also commented that he didn't like the look of his flat teeth, and he thought his teeth were darker than they should be. Just for my own notes, I've noted that he's always had routine care to date, and he's had no previous ortho. So nothing else was going on there with him. But I know that information because I want to go over it with the patient. So he's not really happy with his smile. He wants to improve it. He wants to correct the wear, change the shade, and make it last, And so I've got those little quick notes for myself so I can go over that with the patient when I talk with them. So we kind of start, when you first came, we looked at your teeth. We looked at how they fit together. We looked at their shape, their shade. We looked at the size. And then during your exam, you and I pointed out teeth that were worn down, small and flat, along with some others that were crooked and they were chipped. So if I'm making any sense here, what we're doing during the presentation is really just reviewing what we talked about at the exam. Because during the exam itself, that's when the patient, when I showed him worn teeth, flat teeth, whatever, he had already mentioned that he didn't like the way that his teeth looked. However, no patient is ever aware of the intensity of the condition. Like, how far has it gone? This is going to be a lot more complicated to reconstruct than he's probably anticipating. And so I want to prepare him for the fact that there are quite a few teeth that we're going to have to look at. But I just want to review with him. If you recall from our exam, we looked at the, how your teeth fit together. We looked at their shape, shade, size. We pointed out some teeth that were worn down, small, others that were just flat, along with some that were just crooked and chipped. And so I'm just reviewing that with the patient. And then as I move forward with how we're going to take care of these things, I explain to the patient that, I can tell you from experience that this wear, it's caused by an unbalanced bite or teeth that don't fit together correctly, and that your jaw doesn't seat properly in its joint, causing the your muscles to be hyperactive. This is what's contributing to the grinding that you've been doing, and it helps to explain your frequent headaches. I got an idea of where that's coming from. So what I did for the patient, or what I would explain to them, is what I did for you is I circled the teeth that had to be treated, because I want to give them an idea of the extent of the destruction that's going on in his mouth. And so I'm just explaining that I circled the teeth on the top and the teeth on the bottom that are going to need to be treated. And I placed arrows next to the teeth that should be considered for treatment if you really, really do want to correct the shade, because these teeth smile. When you smile, you can see these teeth. And so if you're concerned at all about the shade, then doing something with those teeth, I think is going to be important. Now, these could be done at any time. The ones that I've circled, those have to be done to correct the wear and the function and those problems that you're having. And so, believe it or not, you still got one of your wisdom teeth. I could see it up there in the corner. And I noticed it when I examined you, that you still have a wisdom tooth. It's not functional. It's going to create problems for you down the road, and probably rot. So that should be removed as well. And so I'm just reviewing that with the patient. And then I'm going through with the pictures that I took during the exam. And I said, the other thing that I've noticed, and I could see why it bothers you, is that the wear has considerably shortened your teeth and it's flattened all the edges. So you're right. It's giving you a smile of somebody who is much, much older than you are. Unfortunately, your teeth are aging very, very quickly. And so I can appreciate your concern. And so I'm going to just show the patient the things, that I see, and review them with them, and talk to them about them. Your teeth, you've lost some of the space that you have. The symmetry is missing. And so as your teeth have gotten shorter, less and less of them show, obviously. So when you smile, when your lips are at rest, when you speak, or even when you just open your mouth, you can't see as much of your tooth as you normally would have, all the time. So obviously, when more of your teeth show, your smile appears fuller, it's brighter, more youthful. And I can understand, why you might be unhappy with your teeth right now. So I'm just going to move along on those photos. I'm also going to explain to them that their teeth, the symmetry is now missing, from their teeth. Let me get to that right slide. Yeah.
Hey, Larry,
Yeah.
I've got just a quick comment about that. I want to highlight something that you said earlier, and that is when you are able to present something like this, where you've got the goal on the left-hand side and you show them their images maybe on the right-hand side. When somebody comes into the dentist, at least I was always like this. There was this financial incentive bias that I always had with the dentist. When people talk about doing things for your boat, that kind of thing, the person who is telling you what the problems are is the person who is also financially incentivized by that. And when you're able to show them these pictures and something like this in the mouth, it takes that completely away. And so when you're presenting the goal on the left, and this is where you are on the right, we want to get you here. Is that important to you? And any bias that they had will go away, because that's where we want you to be. That's where we want you to live. There's a reason we're recommending treatment, and now you can see it very clearly.
Well, thank you for bringing that up. And that's the whole part of utilizing pictures and things like this that are set up for you already. So that way patients could see the difference between where they are and where they could be. I'm going to go through and continue to explain to the patient that, while we were examining you, we discovered that the angle of your teeth also, it distorts symmetry. It doesn't allow for a uniform appearance. And some of them are even difficult to clean, and that explains the problems that you're having with your gum. So on a side note for the dentists who are listening, usually what I find is that when I'm coaching clients is that the pictures alone are enough to demonstrate their problems. However, I usually recommend that you have study models, scans, radiographs, articles, whatever you need, biologic models, any reference materials, have all that on hand. Don't just rely on your photographs, although most of the time, for most patients, just looking at the picture is enough. But if they need further explanation, you don't want to be fumbling around looking for stuff. So I like those biologic models, with those peel away gums to show people periodontal problems and all of that. Those biologic models are a really easy way to explain a crown because you can kind of pop it off and pop it on the model. Same thing with a veneer. So have those things around. You just don't want to be fumbling around during the treatment presentation. And so it's best just to have those in your consultation area. And so if you need it, you could just grab it off the shelf. If you don't need it, it could stay there. But after you show them all the things that you've been looking at, then you can start to explain to the patient how we could solve the problem. So up until now, we've just been showing the patient, these are all the things that we've been seeing going on in your mouth. And so you want to help the patient understand how each problem can be solved. What Dr. Dawson would say is that to get your mouth healthy, looking better, and for you to be able to keep it that way, that's what we want to be able to do. We don't want you to have the same problems that your parents have had. And so we're going to be able to help you with those things. The good news about what's happened to your teeth is that it seems like we caught it early. And so even though there's been a significant amount of wear, we've got enough tooth structure in most cases here where we got something to work with. You know what I mean? So we're going to be able to help you get your smile back. And so the first problems that we're going to have to address is the condition of your gums, obviously. Then we want to be able to provide relief for your headaches and stop your teeth from wearing down any further. So we want to take care of the gums, help you with your headaches, and stop your teeth from wearing any further. So right now, we do have plenty of tooth structure to work with. And so I'm expecting that we're going to get a really, really good result in doing this dentistry now. So after we've stopped your teeth from wearing, once we've gotten your bite stable so that you don't have to worry that your teeth are going to wear anymore, we can move on to straightening your upper teeth because we want to get that uniform look. And we want to have the ability to have you clean them better and make it easier for you, as well as we want to lengthen the two front teeth and the four teeth just below it by contouring the gums. And so by doing that, we'll have just a more uniform smile. You see, lengthening them provides more tooth structure and allows the dentist, me, to restore what's been worn away. That's what I want to be able to do. And as we've discussed, when more of your teeth show, your smile appears fuller, brighter, it's more youthful, all the things that you had mentioned when you first came in to see us. So also by lengthening your teeth, we're going to be able to widen them. And this is important because you want your teeth to be in proportion of one another, particularly to the new length. So this way they'll be longer more than they are wider. And it'll take away from that boxy look that your teeth have right now. So they're going to look a lot more attractive when they're in the right proportions. So contouring the gums, as I explained, it's not only functional for you to give us more tooth structure to be able to work with, but it also makes your smile look less gummy. And with the proper amount of gum showing when you speak and smile. So you won't have all the gums showing. And I think you'll have a more aesthetic look that you'll really be excited about. So when I get to this point, then I'm going to balance the bite. So your teeth fit together and they're resting on top of each other with equal pressure. This is what will prevent further wear, increase comfort, and assure that the treatment is going to last long. This is a really, really important step. So if I'm doing my job correctly here with all the dentists that are listening, I think what you'll recognize is that I told the patient in lay terms what you all know as reshape, restore, and reposition of his teeth. So after reviewing how the problems can be solved, you're ready to make some treatment recommendations. So basically, what I've done through this presentation so far is just show the patient all of the things that we talked about during the examination. And so when I start to explain the treatment, I also want to consider, any options that were available. So when they call back to cancel, it's usually because they didn't know they had any options. They didn't know that there was anything else that can be done. So you start by explaining that you've only considered treatment that addresses your headaches, worn teeth, and restores full function back to chewing and speaking that will not continue to damage your teeth, because that's what's been happening to the patient in the past. As they spoke, as they ate, as they chewed, they actually were wearing their teeth more and more and more. And so we're going to restore the teeth back to full function so that you can do all these things without actually mutilating your teeth. So a side effect of restoring your teeth this way is how great they look, because they'll be straighter, they're going to be longer, and they're going to be brighter. And I would explain to the patient that, I thought of skipping. This is where I'm kind of giving them some alternatives. I thought of skipping the steps to balance your bite and lengthen your teeth. However, the problem with that is it'll only give you a better looking version of the little teeth that you have right now. It's not actually, they'll look better, but they're not going to look the way they did when you were younger. And we really want to put back all the tooth structure that's been worn away. So if I don't balance the bite, then it's not going to last very long. And that was part of the issue, that you felt if you were going to make this type of an investment, that it needed to last long. It's because unbalanced bites are what causes teeth to chip, to break, and actually cause people to grind. So that's the problem that you're suffering with now. So the treatment that I'm recommending, it not only improves function for you, it'll be comfortable, it's going to look good, and it's going to last long. So the side effect of restoring your teeth to full function is how good they're going to look, how comfortable it's going to be, and how long it's going to last. So I'm really excited about that for you. So Dr. Dawson always talked about just presenting one treatment plan. And I agree with him that patients get very, very confused when we say, here's option one, here's option two, here's option three. Because then patients want something from one, something from three, and then let's throw in something from two, because they don't realize that these are three separate plans to do three different things for the patient. And so it gets very confusing. This is where your examination really, really comes into play, because patients can help you know what direction to move in. A simple way that I know when I'm working with clients that I explain to them is, let's say you have a patient and you're talking to them, and you see that they have a missing tooth. I would stop the exam and I would say, well, Mrs. Jones, I think you can see as I'm examining you that you do have some teeth here that are going to need to be treated. And well, I could use your help, because I'd like to know what you think about what direction would be comfortable for you to move in. Because with a missing tooth, I'm just wondering, do you like something that you place in your mouth permanently, or would you prefer something in your mouth that you just took out every night? And then I would explain to them, we've got a couple of options here. I would explain to them, we have well, the patient will tell you, do you want something permanent, or do you want something that you take out every night? A lot of patients will look at you and go, well, I hate to take it out every night. And, that permanent solution there probably is more expensive, but I think that's what I'd rather have. I remember my grandmother had teeth that she took out every night and she never enjoyed it. and say, well, I can appreciate that. I think today we could do a really good job with something that was permanent, but now we've got a couple of other options for you. And so I'm just curious what you'd be most comfortable with. And then I would explain to them, we have the option of an implant, and we have the option of a bridge that we could place over the area where the tooth is missing. And then I'd give a brief explanation of both. However, when I was done, I would explain what I don't like about the bridge option is that I have to wear down the two teeth because it attaches to the two teeth that are next to the tooth that's missing. And when I look at those two teeth, they've never ever had any other restorations done to them. And so I would hate to have to reduce them to anchor the bridge on it. But Mrs. Jones, I don't want you to think that this isn't a good procedure for you. I just rather not agitate teeth if I didn't have to. But the bridge is a great option. And if it's something that you prefer, as I'm looking at my records and pictures and x-rays and things like that, I can determine whether you're a good candidate of it. The procedure that I actually think would be better for you is what's called an implant. And again, I would just basically explain an implant. But what I like about it is that the reason why I like the implant option for you is that it allows me just to treat the tooth that's missing. I only have to treat that area. I don't have to touch those two teeth next to it. So the implant, I think, is the better option for you. But Mrs. Jones, both of them are excellent, excellent options. I'm just curious what you would prefer. And usually patients will think about this and they'll usually come back with something like, well, I like the idea of implants. I know people who've had them and they've really liked them. And I've heard all about those, but boy, I've heard they're really expensive. So maybe I'm going to have to go with the bridge, or maybe they're going to say, I'm going to go with what my friends have told me about it. My point to you is you shouldn't have to feel like I don't know what to treatment plan because I don't know what this patient wants. I would ask them, you want something permanent or do you want something something removable? If you want something permanent, do you want something like a bridge or do you want something like an implant? They'll tell you during the exam. They might even mention to you, well, I'd like the idea of that implant, but they're really expensive, and say, well, in your case, an implant is probably going to run about $1,000 or $1,500 more than if you went with the bridge. But Miss Jones, how does that sound to you? You know what I mean? Again, what I want you to hear is that when you're just in the exam and you're not at a point where you're asking the patient to make a decision, they're going to be very relaxed. And so they'll talk back and forth with you. Doctors should get comfortable talking about money. Your treatment coordinator will give them the specifics of exactly how much it's going to cost and how it'll be handled by their insurance. But while you're just working with the patient, you're just giving them an idea of things run about this much, or they run in this range. But you're getting an idea, what direction does the patient want to go in? And when you know that, then okay, they want to go with the bridge or they want to go with an implant, then I'm writing a treatment plan, one treatment plan, but just for that item. And so, once you've explained to them what you're going to do, then you can explain to them how you're going to do it, And so again, in the Smile Wizard, you can have notes there. You might not be showing this to the patient, but right in the Smile Wizard, you're going to have your notes about what the treatment is going to look this way. So I would explain to the patient that we're going to start by getting your gums healthy with a therapy called periodontal scaling and root planing. That's going to remove the bacteria growing on the roots of your teeth. This disease eats away at the supporting bone and causing your gums to bleed and swell. And this is going to take about 4 appointments. While this is going on, I'm going to be studying how your teeth fit together to determine their proper position in your mouth and to learn if there are any other options worth considering or changes, are going to be necessary. But I'm not anticipating that anything's going to change here. I'm also going to fabricate a splint which resembles a mouth guard, and I'll have you wear that at night. And it's what will provide you relief from your headaches. And it's going to be the guide that I'll use to know how your teeth should be shaped. And this therapy will probably take about 2 months. So again, you're just telling them how we're going to do it. I'm not saying number 18, number 19, number 20, anything like that. I'm just explaining to them very, very easy. Once you get comfortable in the splint, we're going to begin straightening your front teeth, and we can move your teeth with a set of clear retainers today. And that doesn't require wires or brackets or anything like that. It'll take just about 2 months, and we'll be able to get those teeth in the front all straightened out. And so now it'll be time to get your other teeth ready, because we're going to remove that last holdout, that molar back there, that wisdom tooth that's still there. And then we'll lengthen the two front teeth, and then we'll do the four below it by contouring the gums. So the one tooth on top where the gum is receded can be repaired with a graft, and that'll allow the contouring of your gums to be in perfect proportion. Beauty's, in the eyes of the beholder, so it's up to you whether you want to have that done or not. I would recommend that you do, because it will really finish this off and look really nice. And I think you'll really, really be happy with it. So once we get to that point, now I think the really fun treatment gets started, because I'm going to put crowns on the top 6 front teeth, and I'm going to use veneers on the bottom 4 teeth, just below them. So the 2 additional teeth that show when you smile on top, those could be done with a veneer as well. And the 2 on the bottom, I think, can be restored with composite that's bonded to the tooth. Obviously, I want to start with the top first and then the bottom. And all of these can be done like in 2 visits. So when your new teeth are in place, I'll even out your bite with an equilibration and reshape your splint for you to continue wearing at night. And it'll also just be an added measure of protection for you. All of this will probably take it's probably going to take about 2 more months to get that done. So we're just moving along, explaining what we're doing. We're letting the patient know that we don't want to create a problem that's bigger for them than what they've already got going on in their mouth, but we do want to make them aware of what they should expect if treatment isn't done. Those implications are important, and so I would go on and explain to the patient, because there's already been a considerable amount of damage to your teeth for someone your age. This treatment's not only going to look good, it's going to be comfortable, and you'll prevent further. I don't know why my computer keeps popping like that. It will prevent further destruction of your teeth. And so the main focus of what we're doing here is that this is going to keep your teeth from continuing to wear. It's going to stop that. And so because of it, you could expect many, many years of comfort. And my experience tells me if you don't stabilize your bite, you should expect that the wear in your teeth is going to continue. It's going to cause further muscle hyperactivity, and those headaches are going to continue. So at the rate of wear that you're currently experiencing for your age, unfortunately, honestly, I anticipate that, honestly, you're headed for dentures. And so again, what you're doing is just giving them your professional opinion. But most of you, I think, would agree at his age and where he is with wear, things aren't looking good for this guy. And so I would just let him know you're headed for dentures or tooth loss or anything like that. So I would explain to the patient that, I don't want to create a bigger problem for you than you already have in your mouth. And so once we get started, I need to know if there's anything that'll keep you from getting all of this done in the 4 to 6 month time frame that we've discussed so far. So notice I'm asking this patient, even before they've agreed to treatment and even before they started, I'm letting them know this is going to take 4 to 6 months to get all this done. And for me to get my very best result, there can't be any stopping, And so I'm wondering if you can see anything that would get in the way of you being able to complete this. Because I want to work all this stuff out before we get into it. And I certainly want to get it all worked out before we start making financial arrangements and everything. So we're moving along with the patient. And so if we have to work out alternatives, we can. I mean, I think you can be empathetic, but honestly, I like it best when we work out those alternatives at the examination. And what I have found is if you explain we could do this or that, what do you think would be the best route for you, Miss Jones? Often what you're going to find is that patients are going to ask you, but how much is all this going to cost? Well, because you're changing the shape of their teeth and the position of their teeth and the anatomy of their teeth and the aesthetics of their teeth, these patients are probably going to need some advanced records, and so I don't recommend that you put any patient through diagnostic records, a FACEBO, bite registration, things of that nature. I don't recommend that you put them through any of that without giving them at least some idea of a range. Miss Jones, I've done treatment on patients like this before, and they've spent as much as, I always say, give them a number. They've spent as much as $25,000 to have the type of problem that you have solved. And tell me what you think about that, or how does that sound to you? I want to give them a number. And what I want you to remember is that we're just at the exam, we're just gathering data. We're not asking the patient to make any kind of a decision or anything like that. You should think of yourself as, I'm just one person talking to another person. And the intention of explaining it this way is so that the patient feels very comfortable with you. And when they feel comfortable, they'll ask about money. We don't want them to find out at the consult after you wrote up the treatment plan and talked to the specialist and all those different things that you need to do to come up with a treatment sequence and everything, only to find out that the patient thinks that if I had known this was going to cost that much money, I would have never even started on any of this. And so I'm not afraid to let them know, because patients know that it's going to cost money. I just want to discuss it, how much I think it's going to be. I want to discuss it with them when they're more relaxed, not when they're at a consult, when I'm expecting to make financial arrangements and then, get into financial arrangements and maybe a deposit and things of that nature. So I do want to probe for any objections and things that's going on with them, you know. Then I want to explain, well, can we talk about where would be the right place to start? Because in this patient's case, if he feels like he wouldn't be able to complete treatment maybe in 4 to 6 months, we do want to get to that point where the bite is stable, where I had explained to them, once we get to this point, you'll stop having, your headaches should probably be reduced, and your when you're biting or chewing or talking or whatever, your teeth aren't wearing themselves anymore. Once we get your bite stable, we can take as long as you want on all the other crown and veneer work that we were going to do. But I know just from years of doing this and coaching clients, once a person gets that stability and they're comfortable and they can keep their teeth clean and all that, they're like, we're moving forward, But we always talk about this would be the right place to get started, because there's a lot of things that you've got to do with the patient, and you know, some of these things we can buy some time on because we can't get to them right away anyway. We've got to do all that preliminary mouth preparation and get the teeth all in the right position before we move forward. But doing that also has an advantage for the patient because it stops the wear. It stops the wear. So I would present the total fee after all the treatment is understood by the patient. So I would just ask them, how am I sounding here? Are these things making sense to you? It shouldn't be a surprise to them what you're talking about, because you should have already brought all this up during the exam itself. At the presentation, you're just kind of summarizing, these are the things that you told me that were important to you. You gave me your why. I pointed out all the conditions that were interfering with, what your why was, and explained what I'd be worried about if you didn't move forward with treatment, what you could expect. And so if we take care of this, your mouth is going to be healthy. You're going to be able to keep it that way. And then you can give them the fee. I would explain to them that the fee for all of the treatment you described, the material, laboratory costs, etc., Miss Jones, it is in the range. that I was anticipating. It is going to run X, and I would make sure that your treatment coordinator was with you whenever you're explaining treatment to a new patient. And so that way, when they want to know about payment plans and things of that nature, it's not a problem. Susie's here. I wanted her to be familiar with her case. We do make financial arrangements with our patients, and she could help you with those details. Um, I like it when doctors learn to feel comfortable talking about fees because patients expect to be able to talk to you about it. Nobody ever has reported to me that, yeah, the doctor dumped all this information on me and then left me with somebody else to work out the details. I didn't even know how much it was going to cost. Usually they'll say, I don't know why the doctor couldn't have told that to me. Um, I like doctors to feel comfortable talking about money because a patient that never has any questions, and it happened earlier in the example that I gave you, as soon as they had an idea of how expensive it could be, they have a lot of questions. And so who's the best person? Who's the best person to answer those questions? It's going to be the dentist. It needs to be supported by the hygienist, your dental assistants, by your treatment coordinator. They need to be familiar with conditions. They need to be familiar with implications so that they could reassure and encourage the patient. But it should be the doctor who should be able to answer all of those questions. So I'd ask the patient, how does that sound to you? And tell me how this works for you, whatever you feel comfortable with. And then you would move forward. The one thing that Dr. Dawson always said, and I'd still agree with him today, is that if the doctor makes the arrangements, the doctor collects the money. So I want to make a distinction. There's a difference between making financial arrangements and just talking about money. Ms. Jones, what you can anticipate is treatment like this when I've done it for other patients who had the same problem. They spend as much as $25,000 to $35,000. And I would anticipate that your treatment is probably going to run in the same range. But tell me, Ms. Jones, how does that sound to you? More than likely, this is going to come up during the exam. And if it doesn't come up during the exam, it needs to come up before you start taking diagnostic records on the patient. Because even then, if they've never asked about it, I would say, Ms. Jones, let me give you an idea of what you can anticipate for a fee before we get started taking records. Because I wouldn't want to take records, write up a treatment plan, have them back for a consult, only to have them say, if I had any idea it was going to be this much money, I would have never done that. And you're probably thinking the same thing. I'd have never done it either, had I known that you didn't think this was a good idea. So we don't want doctors making financial arrangements for a good reason. And that reason for me is that when the patient has questions about the arrangements, who are they going to want to talk to? They're going to want to talk to the doctor. And we want them to talk to the front desk because they're always available. So the doctor could talk about ranges of fees and just make sure that the patient is comfortable with it, but then leave the specific details and the financial arrangements of how they'll pay for it with the treatment coordinator. That way, when they have questions, they will ask they'll just ask the treatment coordinator. So I like the treatment coordinator to be present during the consultation so that they're aware of questions and concerns of the patient. And better than that, the patient knows that the treatment coordinator understands what's going on. So, again, if I'm doing my job right here, it doesn't have to be complicated. It doesn't have to be too technical. I didn't use any big words. I'm not good with them anyway, because you want it simple and easy to understand. The key here is better understanding is what engages the patient to ask more questions, to get further clarification. What I've always learned was that once you confuse them, you lose them. And when you lose them, it's because they stop asking questions because they don't know what you said, And so we want to keep it simple because if they can kind of follow what you're doing, if they do get confused, they'll ask for further clarification by the questions that they ask. So what I'll end here with is that clarity gets a yes to treatment. And so with that, we're right up at 8:00, but I'm not rushing off. If anybody has any questions, I'm happy to answer them for you. I do have a shameless plug because it normally comes up in this anytime I'm talking about treatment or treatment presentation, is that I think many of you are aware that we have the Team 360 course. It's designed for the doctor and the whole team. We want them to understand this whole process, as well as how to communicate on the telephone, how to do scheduling. We want everyone to understand some of the basic finances of the office, like when we're healthy and when we're not healthy. And we teach it this year. It's going to be in Tampa, September the 11th or 12th. It would be great if every single one of you can be there. But I'll tell you, it's a whole transformation when the whole team is in the room together and they're all learning together. So it's a shameless plug, but it's great when the whole team understands what's going on. And you know what? We have a lot of fun too.